Welcome to the Boys of the Blue Triangle Men's Skill Set. This is month 1, dealing with fundamental physiology. Week 3, living well enough to meet the grandchildren. Topics covered are non-cancerous prostate disorders, prostate cancer, testicular cancer, erectile dysfunction, genital hygiene.
So, the pre-game analysis. What's the score? Who kicked the goals? Who's scoring with blood pressure and gut loss? Well, today, let's have a look at the men-only club, the anatomy of the key players in this team, and also we'll look at lower urinary tract symptoms, or LUTs. First of all, let's just have a look at the anatomy. Now, we have the testes, and we've talked about how in the previous game how testosterone is manufactured in the testes. We've looked at how testosterone affects our health. The testes also produces the sperm that gives us the reproductive potential. We have up in here the bladder, and in the middle here prostate gland and the penis. Now we'll be talking about these and how they come together, so to speak. Now, at the testes, when ejaculation takes place, spermatozoa leave the testes and travel through the epididymis, which is like a railway station with lots of tubes and lots of platforms, and this is the process of organising the spermatozoa from the testes into the vas deferens. Now, vas deferens is this tube that you have snipped when you have a vasectomy. So the spermatozoa move along this tube. Now, they're not live sperm yet. There's a process going on here. And as the spermatozoa reach the seminal vesicle, there are 2 of those. Now, this is where fluids are added to the spermatozoa to feed, nourish, and protect them and start to convert them into sperm. And then the process continues through the ejaculatory duct, which is a tube, now penetrating the prostate gland. And you can see how the urethra leaves the bladder, enters prostate gland, and those 2 tubes join together. So at this point, the prostate releases further fluid into the ejaculatory duct with the fluid from the seminal vesicle, and the spermatozoa become sperm. They become live swimmers and continue along down through the urethra into the erect penis, and when the ejaculation takes place, then we have a reproductive potential. Now, along the way, you see the Cowper's gland. Now, this gland releases further fluid that precedes the ejaculatory process to create a safe pH, an alkaline base in the urethra and also in the receiving vagina. So that precedes the sperm and provides for a safe passageway. Now, for some men, there seem to be live sperm in that pre-ejaculatory fluid, which can then result in an unexpected pregnancy. Now, researchers are not certain why this happens, how it happens, or even if it does directly contribute to unnecessary or unplanned pregnancies, but it seems to be feasible. So this is a pretty complex piece of machinery, isn't it? But things can go wrong, can't they? Murphy's Law. If they can go wrong, they will. And for men under 40 years of age, these things include testicular cancer, a relatively rare disease, but can be fatal because it's fast-moving and usually affects younger men aged between 18 and 39. About 550 men per year in Australia are affected by testicular cancer. There is a 95% cure rate if detected early. Testes self-examination for hard, painless lumps is the best method. Sometimes they are painful lumps, but they're usually hard and painless. It's a younger man's disease, and it's relatively rare. More common is premature ejaculation. Very common, especially among younger men or any men in a new relationship, mostly caused by performance or generalised anxiety, like fear of rejection or low self-esteem. Now, usually resolved with self-confidence and experience. Well, they're really words for age, aren't they? Self-confidence and experience. And this responds well to behavioural therapy or sex therapy. Now, lifelong premature ejaculation may be caused by chemical imbalances in the brain. Remember how we talked about the brain controls what happens at the testes through the pituitary gland releasing certain hormones. Now, this can be treated successfully with drug therapy. Make sure you see your GP about this, because there are plenty of products available on the marketplace that are not necessarily effective and can be quite expensive. Low fertility also affects some men under age 40. In fact, 1 in 5 couples who have trouble conceiving, the issue lies solely with the male partner. Now, there can be many causes, but they include low fitness and high body fatness, which influence the volume and quality of sperm and semen. Recent research implicates environmental toxins as well, in particular residual pesticides on fruit and vegetables and in the food chain. So beware of that one if you're in this part of the team. Sexually transmitted infections are much less risky with condom use every time. And other risky behaviours for younger men include steroid and alcohol abuse. We see testy-fueled violence, don't we? And aggressive driving and extreme risk-taking with this population. This is the sort of stuff us older blokes in the team look back on with horror, don't we? Now, things can continue to go wrong. For blokes over 40, these are often low testosterone, which we dealt with in Game 2, or erectile dysfunction, which may be caused by simple fatigue or tiredness, or by an underlying medical condition, like smoking-related peripheral vascular disease, or cardiovascular disease, or associated diabetes and peripheral neuropathy. You notice the peripheral vascular disease and the cardiovascular disease are often about circulation systems, aren't they? Well, the diabetes and the peripheral neuropathy are about the neural system, the nerves that get damaged with those disorders. And that's true with multiple sclerosis. That's a nerve damage disease. Or there may be simply emotional status issues, that is low self-esteem or performance anxiety, just as it is when we are younger. With regard to the premature ejaculation, it can be an issue as we get older with erectile dysfunction. Or there can be simply social issues, loneliness, being alone, having no opportunities. We know that men are better off in relationships than living alone as we get older. Now, some men don't achieve erections at all simply because they lack desire. They're not interested. So the continuum for an active sex life is firstly desire. You've got to want to be involved. And that's followed by the arousal process. That is where the brain-testy loop with the different hormones released through the pituitary gland toward the testy creates arousal. That's the hormonal factor. And then we have function. And function is where we see the mixture of the circulatory system delivering blood into the penis for the erection. And that's where you see Viagra being used. That is what it's for. It's a circulatory function. So there's not much point having the Viagra if the hormones are wrong, is there? Or there's not much point having the Viagra if the desire is not there in the first place. Now beware of natural remedies available over the internet, because some contain prescription drugs not regulated in the country of origin, and they can be fatal if taken with a cocktail of things you might be using for depression or things you might be using for function, like the Viagra, and that is something that needs to be managed by your GP. So the third thing we'll look at is prostate issues. And we'll look at prostatitis, benign prostatic hyperplasia, BPH, and prostate cancer. So first of all, let's look at prostatitis. This is a common condition caused by a bacterial infection or a non-bacterial inflammation of the prostate. Now, this is often confused with the symptoms from BPH, from benign prostatic hyperplasia. So it pays to develop a close relationship with your GP to help with an accurate diagnosis. Now, the second is the more common benign prostatic hyperplasia, BPH. Now, normally when cells get bigger, that is called hypertrophy. And normally when cells multiply, called hyperplasia, you'll worry about it as being a type of cancer. But BPH refers to a progressive enlargement of the prostate, usually beyond age 40, and it is not linked to prostate cancer. It affects almost all men, but some never experience the lower urinary tract symptoms, the hesitancy to urinate, or urgency to urinate, or dribbling afterwards, or straining. Now, these occur because the prostate is positioned around the urinary tract, and enlargement puts pressure on the base of the bladder. Now, medicines and surgical procedures can help in severe cases, but dietary curries and spices help many men with milder symptoms. And these are the sorts of herbs and spices you find in like an Indian restaurant. You might notice you go to an Indian restaurant and you have a nice hot curry. Next morning, you can pee like a horse. Well, that can be the reason why, so it is worth trying. Now, prostate cancer, we hear about a lot, don't we? The trouble with prostate cancer is in the early stages of the cancer, it is symptomless. You don't get any of those symptoms until it's almost too late. Now, it's the most common form of cancer in men in the developed world. But many men outlive the prostate cancer and in fact die from other causes. That's my goal, to outlive prostate cancer and die from something else at a ripe old age. But more aggressive forms of prostate cancer afflict men who have high levels of gut fat and associated inflammation. And these more aggressive forms of prostate cancer can kill you before your next birthday. It seems that diet plays a significant role in both the prevention and delaying the progression of prostate cancer. And it can play a role in preventing the more aggressive types of prostate cancer. So, eat more isoflavones. These are found in soybeans, kidney and baked beans, chickpeas, lentils, peanuts. In fact, peanuts are not really a nut, they're a bean, they're a lentil, so they should be called pea beans. That's probably not a very good word for the marketers, so they're called peanuts. Lycopene is found in tomatoes. It gives it that rich colour, and it seems to be released and become bioavailable when cooked. So tomato sauce is great. Pasta sauce is great. Oh, and just imagine if you mix the tomato sauce with the baked beans. What a powerful agent you have there. A powerful cancer-killing agent in a great meal. Just make sure the baked beans and the tomato sauce are not full of salt, which can cause another problem, or full of sugar, which leads to something else, doesn't it? Also, the cruciferous vegetables. These are the types of broccoli and cabbage and Brussels sprouts that you see growing above the ground, lots of green in them, lots of tightly bound cabbage-type products. Those are the ones that also have that green stuff, that chlorophyll, that seems to be very useful in killing off cancer agents in the early stages. Now mix that with garlic and onions, because the cultures of people that use garlic and onions seem to have lower levels of cancer generally, in particular lower levels of bowel cancer. Curries, chilies, turmeric, those are the ones that seem to reduce the risk of prostate cancer in men, in particular the turmeric. Turmeric gives us that yellow colour we see in the curries. Chilies usually gives us the heat. Mix them all together. Cancer doesn't like it. Wash it down with some green tea. And these are things that we know make a big difference in reducing the risk of aggressive forms of prostate cancer. Now, it's out of bounds on the fool to have a high meat diet and a meat diet with overcooked meat. So the high meat diets, in particular diets that have, or meats that have lots of salt added or lots of preservatives, the sulfites like the salamis and the hams and so on, they seem to be particularly bad for stomach cancer. You mix the meat with the salt and the preservatives, bad news for stomach cancer. Overcooked meat, the stuff you see on the barbecue, seems to be particularly bad for bowel cancer and prostate cancer. So a moderate meat diet and not overcooked is the way to go for prostate cancer and bowel cancer and stomach cancer. Now you might ask, well, has genetics got anything to do with it? What about my family history? Does that mean I'm in for it too? Well, the answer is yes and no. Now, if you have a close male family relative, a father, brother, uncle, who has had prostate cancer early in life, that is before age 60, then you are at higher risk and you should be tested for prostate cancer after about age 40. Now, the genetics and the family history are risk factors, not causative in themselves. If you have a family history of prostate cancer, then, as in the case of all diseases like diabetes and heart disease, you make sure you do your bit to reduce the chances of getting the disease. Now, this lifestyle modification is actually what we think now as epigenetics. This is the stuff around the genetics. This is the stuff that is going to make a difference from the moment you do this onward in your health, but also in the health of your children and your children's children. Now, screening for prostate cancer is contentious. The best minds in the world disagree on this. That is the PSA, that is the prostatic specific antigen that is being related to prostate cancer. It's a tricky one because the larger the person, the larger the prostate, the more PSA you actually create. Then we know about the digital rectal examination. And this is what we've relied a lot on the past. And then there are biopsies and so on. So what chance do we have of figuring all this out if the best minds in the world disagree about it? Well, ask your GP about the options that are appropriate for you. For example, ask about a new one that is about MRI screening for blokes at risk. This is the very latest trend in screening for prostate cancer. By the way, in testicular cancer, the family history is a much smaller risk factor than it is for prostate cancer. And testicular cancer appears to have nothing to do with playing footy, getting a knee in the cods or anything like that. So where do you go to ask for help? Well, a good place to start is Andrology Australia. Here is the website. It's a fantastic resource linking around 25 associated organisations, and they even have a doctor locator if you haven't got one in your area.
Now complete the quiz that looks at this video and return the results.